Dr. Roadhouse, and I want to introduce you to my patient, Will. Will, why don't you just tell us about the symptoms that you were experiencing before you came in to see us?
A lot of muscle tightness, tired, sore muscles all the time, stiff, a lot of trouble sitting for more than just a minute or two, without having to get up and stretch and move around.
Okay. Did you ever have any pain into the arm or anything like that?
No, mostly the upper back between the shoulder blades and then down the sides mostly.
Okay.
So.
Right. And did the symptoms kind of come and go, or were they pretty constant?
Yeah,
Constant.
all the time.
Okay. All right. And did you get any sharp pains or anything like that?
Yeah, behind my right shoulder blade got pretty bad pain pretty often. So.
Okay. And one thing that you don't see right now is, but when you came in, you couldn't sit here like this. I mean, you weren't sleeping.
Right.
Right. So, and also, you just seemed like you were agitated all the time, because I remember when we were doing the consultation. I mean, you weren't able to sit still.
Right.
And was that because of the pain, or what was it?
I always felt like I was having muscle spasms.
Okay.
Always kind of feeling stiff and feeling like I needed to be stretching and stuff, basically.
Yeah.
So
were you ever able to get rid of the symptoms at all?
No.
Okay. So it just built. And how long? How old were you when you first started?
About 20 or 21. It's been about 10 years.
Okay.
So.
All right. And so during that time, it just gradually got worse and worse.
Yeah, the affected area has gotten bigger, basically, is what it was.
Because it went like this and went up and down, but it didn't go into your arms or hands yet,
no.
Right? Okay, good. All right. So then talk about some of the doctors that you went to.
Went to first just my doctor and asked him about it, and got some x-rays done, and he thought it was spinal stenosis, and then he sent me to a specialist in Muskogee, where I'm from, and he looked at it and decided it was spinal stenosis, and pretty much gave me a little chart of stretches to do and said that was about all that could be done for it. And then about 4 or 5 years later, when it started getting really bad, I went to Bone and Joint Clinic, and they pretty much said the same thing. Just spinal stenosis, not really anything can be done for it, so other than surgery, which I didn't want to do. So.
Yeah. And they evaluated this by doing, did they do one MRI or did they do 2?
Actually, Bone and Joint Clinic did one, but the doctors I've been to pretty much all just went off the x-rays only that I had. So.
All right. Okay. And then obviously you had some family history with that.
Yeah, my dad was diagnosed with spinal stenosis, and I've got a little bit of the same. My x-ray looks a little bit the same. The top 3 discs in my neck are fused on one side, but and they just assumed that was what was causing the pain and the pressure on the nerve, but I guess it's probably not what it was.
Yeah. Well, I mean, they evaluated it, and basically that was it. Your option was surgery, and at your age, you just thought, well, I'm going to put up with this, and what? I mean, obviously, it was a pretty miserable existence for about 10, 11 years, and I know that since you're feeling better and you're smiling, which you weren't doing. I mean, a lot of your friends and family have seen how much better you're doing. Right?
Yeah, they notice it even more than I do, really. So, but yeah, it has made a big difference. So.
Okay. Well, also what we did is, when a patient comes in, we evaluate and we do the neurological assessment. And remember, your cerebellum was in pretty bad shape, and that's pretty easy to understand since you were in pain all the time. You weren't sleeping, and that puts stress on the cerebellum. And so we've got you on oxygen, and then we started doing the cerebellum treatments and everything, and then we did the decompression, and you're doing great. And we've moved up to the 2nd disc, and we're doing good there. And we got you on the rehab and stuff. So kind of talk about some of the things that, obviously you're doing fantastic, but talk about some of the things that you can do now that you weren't able to do before.
Well, really any kind of sitting around the house, whether it was watching TV or playing games with the kids or whatever, was just about impossible because I couldn't sit for more than just 5 or 10 minutes. So basically, feeling like you always just wanted to lay down or go to bed, or not no motivation to do anything basically. So
okay, so now you're doing a lot better.
Mhm.
You're able to do the things that you like to do. You're able to interact with your kids, right? Okay,
Yeah,
good.
that's gotten a lot better.
All right.
So.
And how many months have we been doing this now?
I believe this is almost 5 months.
Yeah.
So far,
Okay.
so.
So we're almost done with him, and he's
Mhm.
made tremendous improvement. The last thing now we do is we're getting him on the ATM2, which is trying to strengthen the little muscles of the spine. And have you noticed much of an improvement on that?
Yeah,
yet?
it has. Just the last couple times, I've started to notice some improvement, a little bit of strengthening in the neck. So
Okay. Now, what about your range of motion now compared to when you first came in?
definitely got better range of motion. A lot less stiffness when I turn my head from
Yeah.
side to side and that kind of stuff.
And you can turn your head a lot
Right,
more
yeah.
compared to when you're in. Okay, good. Well, this is a typical example, because when you came in, we did the neurological exam, we did the consultation, and then we had you bring in the MRI. And then when we read the MRI, the radiologist said that you had 2 bulging discs there. So technically, that can be spinal stenosis, because spinal stenosis is closing down of the spinal cord area, the room there. Well, it was closed down because you had 2 moderate disc bulges, which were pretty darn big. So since we've been working on that and doing that, you've been doing great. And it's taken time, and it costs quite a bit of money. But how do you feel about?
It's definitely worth it. You get to a point after a while where you just about pay anything to get rid of something like that.
Yeah.
So.
And really, when you came to us, you were almost at your last resort, because nothing else would work, and you were real young and just thinking, what's it going to be like?
Actually starting to think about possibility of having surgery before.
Okay.
This was kind of a last try.
Okay,
I did
good.
something like
And
that.
obviously, it's been great.
Yeah.
Okay. All right. Well, thanks, Will. You've been a great
Yeah,
patient, and I'm
appreciate
just
it.
happy to be able to help you out.
All
And
right. Well, I sure appreciate
so
it.
that's Will's story. So if you know anybody that has a problem like this, have them watch this video, because he's living proof.
Definitely highly recommend it. Yeah.
Okay. Thank you.